Culinary medicine to me is integration. It's taking the diagnosis with the patient, the treatment, the nutritional counseling, and having that integrated into the patient's home so they could actually apply that. I think that's where the magic really happens. It's impacted my career because it's impacted my patients' lives. The ability to help my patients through the diagnosis, the treatment, through the nutritional counseling, and to do so in a way that I know is making an impact. And I only know that because my patients have told me. I'm blessed that my staff is there to help me integrate this through shared medical appointments. We are able to coordinate getting in 4, 5, sometimes 6 patients in at once, triaged and in place for our medical appointments, and my staff is willing to help, and we've trained them well, and I'm blessed that I have their support as well as the support of my supervising physician. The only challenge is the time that's needed, but I really enjoyed putting in the effort and the time to become certified. The best thing about that process was collaborating with other physician assistants, medical doctors, dietitians, and culinary professionals. During that certification process, I realized that everybody around me could teach me something. Yes, and it still is, and it will be, because this space is continuing to evolve. And I find that the challenge is that patients really want this. And so there's a market for it that needs to be filled. It just makes common sense. You tell patients about their food and how it impacts their health and how they could cook different things and in different techniques and different seasonings. And you almost just see the light bulb go off as they say, yes, why isn't anybody talking about this? Thank you for sharing that with me. And it happens with other medical professionals that I talk to. It happens with these big organizations that own clinics, and they look at us and say, well, you're a small clinic, so how are you doing this? And you just see the curiosity, whether it's a big health organization or a family or an individual patient. I definitely encourage anybody who's interested to pursue the certification process. The support from the American College of Culinary Medicine helps answer any questions you may have. Whether or not you want to run the big classes and teaching kitchens, or if you just want to extend and have a better conversation with your patients around their diet and how their food affects their health, or anywhere in between those two on the spectrum, the value to the certification is not just for my career, but it's for the patient's health. When it comes to recipes, I feel like my challenge is to take my culture's food, Mexican food, and make it healthy. I shudder when somebody tells me they can't be healthy because they love Mexican food. So one of the things I like to do is take classic Mexican recipes like ground beef or picadillo and sneak in one of my favorite ingredients, lentils. Increasing protein, increasing fiber, keeping the feel of the recipe, and then on the back end letting people know, by the way, there was something healthy in there and you loved it.